So good afternoon, everyone, and thank you for joining us today for our final presentation for our BIPOC Health Awareness Series. My name is Kayla Rogers, and I'm an Education Outreach Coordinator for the Women's Fund. For those of you who are not familiar with the Women's Fund, we are a not-for-profit organization located in Houston, and our mission is to provide women and girls with the tools they need to be advocates for their health. We do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. Our programs and publications are completely free. If you're interested in learning more, I encourage you to visit our website, thewomensfund.org, where you can find out a little bit more about us and download free PDF versions of our publications. It's there that you can also request physical copies of our publications as well. So today we're very excited to have Dr. Pooja Sehgal back with us. She presented over diabetes in 2020, and so we're very happy to have her here with us again today to talk about minority health concerns. So a little bit about Dr. Sehgal. After graduating from medical school at Government Medical College in India in 1997, she went to the Wichita Falls Family Medicine Program for her internship in family medicine, which she completed in 2005. She completed her family medicine residency at Baylor College of Medicine in 2007. Dr. Sehgal is a member of the American Academy of Family Physicians, the Texas Academy of Family Physicians, and the Harris County Medical Society. She is currently serving as president of Harris County Academy of Family Physicians. When she's not caring for patients, she enjoys spending time with her children and traveling. So we are so grateful to have you here today and definitely looking forward to this presentation.
Thank you, Kyla. Just a little disclaimer. I'm a past president of Harris County Academy of Family Physicians. But anyways, I just want to give our audience a good overview of minority health concerns. You know, we all know that disparities in health and healthcare are pervasive, and they have continued to plague our healthcare system despite increasing recognition among patients and providers of the existence of these health inequities. So these are basically undesirable differences in the outcomes or care, and these are generally not driven by informed differences in expressed patient preference. So when we talk about health inequities, they exist in both health outcomes and in health care. So for example, I'll give you a small example. You know, we know that globally it has been very well documented that factors that affect these healthcare disparities are race, ethnicity, your gender, your sex, your sexual identity, your religion, your immigration status, your socioeconomic status, geography, and there are so many other factors. You know, I'm going to touch a little bit on broad, minority health concerns, and then I'll give you a little bit of data about what affects women mostly. Next slide, please. So we'll talk about health coverage. As you can see on this slide, and I hope our audience can see this slide. We are trying to see what kind of health coverage different ethnic groups have. So we're talking about Black Americans, Hispanic Americans, Asian Americans, and white Americans. As you can see from this slide that 89% had health coverage in 2017, only 45% obtaining it from the government health insurance. So this is your Black Americans. Whereas if you compare them to white Americans, you know, almost 94% or more had health coverage, with only 37% obtaining it from the government. Whereas when you look at Hispanics, their numbers on health coverage are really low. And of course, these are the people that are documented to have this insurance, and these are the people that were surveyed. So this, you have to understand, it does not include everyone, because as you know that I don't truly believe that 95% of white Americans had health insurance and 84% of Hispanic Americans. We know that there is a disparity that exists, but I think these numbers are a little bit inflated in my mind, only because, we in our clinical practices also see a lot of patients that really either talk about not having insurance or, not being able to access the providers that they like because of insurance issues. So next slide, please. So we are going to talk a little bit about chronic health conditions. Next slide. So in chronic health conditions, these are the big ones that really affect anybody. And remember, I am only talking about minority populations in general, and not really focusing only on women at this time, but I'll give you some information about women and specific numbers about women. As you can see, high blood pressure, this is the one diagnosis that is seen among the number one diagnosis in primary care practices. So if you look at these numbers, more than 42% Black people, 29 to 30% Hispanics, 28% non-Hispanic whites, and 27% Asians have been diagnosed. So remember, this is also tip of the iceberg, because this is the people who have had a diagnosis, and the claims have been made from physician offices regarding this diagnosis. And CMS collects this data, and so the data is only the people who went to seek help and the diagnosis of high blood pressure was put on their charts. And I said this is the tip of the iceberg because there are so many other people who have not been diagnosed. Doesn't mean that they don't have it. It's just that they don't know that they have high blood pressure, because high blood pressure is a silent killer. You usually do not have any symptoms of high blood pressure initially. Only when somebody really starts having a stroke or has other symptoms that people sometimes may come to know that they had high blood pressure all these years. Another thing is cholesterol, right? If you look at the cholesterol numbers, 12% or almost 13% non-Hispanic whites, 11% Hispanics, 10 to 11% Asians, and 10.2% Blacks. Again, when I look at these numbers, I always look at these with a little grain of salt, because I know that these are not very accurate numbers. But the thing is, we have to go by data. So this is what has been reported. Doesn't necessarily mean that this is all inclusive. Diabetics, you can see, whereas high blood pressure is the most prevalent problem in non-Hispanic Blacks, diabetes is usually seen a lot in Hispanic populations more than any other ethnicity. Whites 13%, non-Hispanic Blacks about 20%. So, when we as physicians see these patients, we know that certain ethnicities are more prone to certain diseases. But this is just a genetic variation. It doesn't mean that if you're more prone to it, if you take good care of your health today, you can actually decrease your risk of that particular condition to a great extent. And I'll talk more about it, what you can do at your end. And then again, obesity, number one, you can see 48% Blacks, and then closely following that is Hispanic population. So this is the ethnic group. Non-Hispanic Blacks and Hispanics really contribute to the majority of the obesity. If you look at these numbers, of course, whites, which are non-Hispanic whites, about 38%, and then Asians, non-Hispanic Asians, much lower than other ethnicities. And next slide, please. So we are going to now talk about the leading causes of death in different ethnicities. Next slide, please. So this is what has been reported again, leading causes of death in different ethnic groups. Black Americans, top cause of death is heart disease. You also should not be surprised to see that heart disease is the number one cause of death across various ethnicities, including Hispanic Americans and white Americans also. Again, across genders also, number one cause of death in men and in women also right now, heart disease. Whereas if you look at Asian Americans, the leading cause of death in this population is cancer. Now, heart disease is kind of a close second here. But if you look at the various populations, various ethnicities all across the world, most everybody has heart disease is the number one killer. And then in certain countries, certain ethnicities, certain populations, it could be a little bit different, like you see in Asian Americans in this country here. Number 2 cause of death in Black Americans or non-Hispanic Blacks is cancer, various kinds of cancer, colon cancer, breast cancer, prostate cancer, whereas Hispanic Americans also cancer, and in white Americans also cancer is the number 2 cause of death. And, of course, different cancers are prevalent in different ethnicities. And then number 3rd cause of death in Black Americans and Hispanic Americans is stroke, whereas number 3rd cause in white Americans is lower respiratory diseases like pneumonia, cystic fibrosis, and things of that nature. Whereas in Asian Americans, stroke is number 3 again. And in Asian Americans, diabetes is number 4, which also you can see other minorities, Black Americans and Hispanics also, diabetes is number 4, whereas white Americans, diabetes does not make it to the top 4 list. Again, this is the data that is being collected by CDC. But, the message from this slide is, if you look at Hispanics and non-Hispanic Blacks, their number 1 cause of death is heart disease, cancer, stroke, and diabetes. So, when I look at these, this is kind of truly reflects what we see in our practices also. But when I look at this slide, what I try to think about is a lot of these conditions on these leading causes of death can be prevented. A lot of heart disease can be prevented. A lot of diabetes can be prevented, or at least if you can't prevent a disease, you can prevent the complications from that disease. Like you can have a diabetes and live a healthy life being a controlled diabetic, versus if you're uncontrolled, you can lose your vision, you can lose your limb, you can have kidney failure. So, these conditions, if they are really controlled very well, you do not end up with a problem. The stroke, the underlying cause is high blood pressure. So if we could really control blood pressure very well with eating right, with not smoking, with losing some weight and decreasing salt in their diet, there's every reason that patient will have very well-controlled blood pressure and never have stroke, or in most cases, I shouldn't say never. I mean, there's a very fair chance that you can decrease the risk of stroke to a great extent. Next slide, please. Okay, so now we are going to talk about what we have in common, because we are all human beings. These diseases affect all of us. So as you could tell from my previous slides also, next slide, please. We are all at risk because leading cause of death with related health issues are heart disease, cancer, stroke, type 2 diabetes. Most every ethnicity has these problems. So what are the risk factors or related factors with heart disease are? High blood pressure, high total cholesterol or high bad cholesterol, diabetes, and smoking. When it comes to stroke, number 1 cause of stroke, high blood pressure, then smoking, being overweight or obese, and certain medications sometimes can increase your risk, but this is really not something that you should be too worried about. When it comes to cancer, of course, smoking causes lung cancer. Sun exposure, too much sun exposure causes increased risk of skin cancer. Then alcohol can increase the risk of liver cancer, and obesity is linked to cancers like colon cancer and breast cancer. Type 2 diabetes, weight, you'll see the weight is pretty much makes it to the top of all the list. This is the risk factor for diabetes, lack of activity, insulin resistance. Your genetics and family history, of course, has a lot to do with your risk of diabetes, and ethnicity, as I said, Hispanics and Blacks more at risk of diabetes. So we are all at risk, regardless of our ethnicity. There are some common risk factors for these conditions, and that's what we should focus on, how we can prevent the disease, or if we have the disease, what can we do to prevent ourselves from the complications of the disease. When it comes to women's health in particular, I'll give you a few numbers, as I promised. Blacks and Native Americans, women, they are 2 to 3 times more likely to die from pregnancy-related causes than the white, even if you adjust the economic status. When it comes to another female conditions, non-Hispanic Blacks are at a much higher risk for preterm birth than their non-Hispanic whites. And this, I'm giving you these numbers when you have adjusted for their economic status. So it's not talking about a particular income group. It's, just talking about ethnicities that just these women seem to have more risk of certain conditions. Latina women, highest risk of gestational diabetes. And, gestational diabetes is diabetes during pregnancy. And once a woman has that, she's always at high risk of becoming diabetic later in life. Cervical cancer incidence is higher in non-whites than in whites. Black women, though, have a lower incidence of breast cancer, but their rate of mortality or risk of dying from breast cancer is much more than seen in white women. Also compared with white women, Black women, they are much less likely to use contraception. And this is an interesting finding we have, and we see in our clinics also. Black women are not very receptive to any form of contraception. And when you combine Blacks and Hispanics, they are 50% less likely than white women to have any effective contraception. Why that is, it could be cultural differences, it could be where you look at certain things, but I just wanted you to kind of think about these numbers, and this does affect your health and a lot of other things in future. Whereas we can always say that certain health outcomes may be attributed to genetics and other biological factors, but sometimes it becomes harder for us to explain these differences in healthcare once a woman gets access to the healthcare. So, you look across different ethnicities, and especially in women, and let's say each one of them has access to healthcare. Certain ethnicities do not access healthcare or do not see doctors as much as certain, like non-Hispanic Blacks and Hispanics. Even though they have access to healthcare, they may not go see their doctors as much as some of the white women would. So I think it's hard to explain. So this is not an ethnic thing, and this has probably not much to do with their income status. I think it has a lot to do with how you perceive certain things, or whether you really have trust in the system. Like what we have seen in our practice recently, that some of the ethnicities have kind of mistrust in COVID vaccine, regardless of how much education we are trying to give in our clinical encounters. Some certain ethnic groups really do not trust the vaccine, and it may be that they perceive information from media in a little bit more distrustful way than some other ethnicities. So I think this is something that we see in our clinical practices, and all across, all the physicians come across these things. So I just wanted to touch base with you on that. So I'm going to talk more about our other stuff. So next slide, please. So this is a little bit telling you about what affects heart disease, because as I said, heart disease is the #1 killer all across the ethnicities and in both the genders. So what basically affects, smoking affects your heart health. So first and foremost thing, if you are a smoker, you have to quit smoking. You have to befriend non-smokers. What this basically means is that if you are around smokers all the time, you actually do inhale a lot of this carcinogenic smoke, and it can lead to your secondhand smoke also is a risk factor for lung disease in future. And of course, lung cancer is something that we are very concerned about. Then exercise is important, because exercise improves your cardiovascular health. Your blood flows through smoothly through these arteries, and you have to, if you're trying to decrease your risk of heart disease, exercise is very, very important. Then it's very important, if you're trying to prevent heart disease, knowing your numbers. What leads to heart disease? If you have diabetes, if you have high blood pressure, if you have high cholesterol, you are at more risk of getting heart disease. So you need to know your numbers. And how do you do that? Some of these things are simple. You can get a blood pressure monitor, start monitoring your blood pressure at home. You know what your blood pressure is like. And blood sugar is a very simple test. You have to see your primary care doctors. You can go to your doctors, they do a fasting blood sugar, then they may do a 3-month blood sugar check. This is very, very easy, and you would really know whether you are a diabetic or a pre-diabetic. And then cholesterol check is again a blood test. A fasting sample is taken, simple test. It will at least tell you where you stand, and if you have borderline high cholesterol, you can change your diet and do certain things so that you do not have increased risk of heart disease in future. And then activity is very, very important. Mediterranean diet is something that a lot of studies have looked at. There's a thing called DASH diet. It stands for Dietary Approaches to Stop Hypertension. It is very close to Mediterranean diet. This diet basically focuses more on natural foods, like more fruits, vegetables, non-fat dairy, olives, avocados. So that kind of healthy diet that really helps you, because you can look at a lot of diets, and some diets talk about inflammatory foods versus non-inflammatory. So DASH diet or Mediterranean diet focuses more on raw and natural foods. So these are considered non-inflammatory foods, whereas more fried, more creamy, more processed foods can cause more inflammation. And we do believe that inflammation is the underlying factor that leads to plaque buildup and eventually heart disease. Also, limiting red meat is important. Red meat has a lot of inherent cholesterol. It doesn't mean that you can't enjoy a steak here and there. What I'm trying to tell you is that too much red meat can be a problem for some ethnicities or some people who have a tendency to have high cholesterol or already have high bad cholesterol. When it comes to exercise, try to exercise at least 30 minutes every day. This doesn't mean that you have to hit gym every day, but it basically means that you have to be active. Even if it means that you're walking in your neighborhood, you're walking your dog, you are doing some yard work, you are biking, you may be doing stationary bike, whatever you do, you have to be physically active. If you have a sedentary job where you're sitting on your desk 8 hours a day, it just does not help. So for most of you who are working from home right now, please try to find some time or make some time that you can walk away from your desk. Even if you have to walk in the house, stay active. Next slide, please. Next slide is your factors that will influence your cancer. So again, as I said, how can you protect yourself? All the cancer, honestly, is not preventable. Sometimes you have certain cancers that we did not know how they occurred or could not control them. But so many cancers can be avoided or prevented by following certain simple rules. Smoking is a big one. That smoking can cause lung cancer. It can increase risk of breast cancer. We now believe that it can cause intestinal and colon cancers. So stop smoking. If you're a smoker, there's really no other argument you need. Every cigarette you smoke makes you sicker. So stop smoking. Stay busy. If you have those cravings, you can chew gums. Smokers have very bad cravings, so it's hard to control those. So you can initially start off with nicotine gum when you are trying to completely quit. But once you are completely quit, you can chew on regular gum so that you have this habit of having something in the mouth. These may help you. And try to stay busy so that a lot of smokers, when you ask them, why do you smoke? They just say, well, I like smoking. I relish it. I don't know why I do it. I know it's bad, but I just do it. So we tell them, start doing something so that your mind is away from things and you just do not, find time to smoke. Secondly, diet is very, very important. As I was talking to you about certain foods causing more inflammation in the body, we don't understand everything what starts a cancer, but we do understand that more natural foods, more unprocessed food or minimally processed foods do decrease your risk of cancer. So if you eat more fruits, more fresh veggies, fresh fruits, whole grains, you really are going to prevent a lot of cancer and heart disease. And of course, limit your alcohol. Too much alcohol, we all know, can lead to liver cancer. And, your environmental factors, if you are going outdoors or you want to be outdoors, you have to wear a sunscreen. Sun rays have a lot of harmful things that can really damage your skin. So you have to protect yourself from, skin cancer, and especially people with light colored skin. They are more prone to get skin cancers. That doesn't mean that people with dark skin do not get cancer. They don't get it as much because their melanin protects them. However, remember that if Black people get skin cancer, their cancer is usually more malignant or more serious compared to when lighter colored people or Caucasians get skin cancer. So that's something you have to understand. Of course, you have to decrease the workplace and household exposure to certain chemicals that are potentially harmful and can lead to certain kinds of cancers. Next slide, please. Talking about stroke, what causes stroke and how do we prevent stroke? And I think in my mind, stroke to a greater degree is a preventable disease. So again, same factors you'll see over and over again. So stop smoking, make a plan. You have to have a quit date. You have to get support from others. What smoking does, again, nicotine is very highly inflammatory. So it causes a lot of inflammation in the arteries, and that's how plaques start. And that's how your, arteries get clogged. And when a blood clot is released from this artery, this goes to your brain and hits just a, artery in the brain, leading to the stroke. So this is what you can do to prevent a stroke. Stop smoking if you're a smoker. Get support and stay positive. It basically means don't stress over small things. Control your blood pressure. This is the most important thing that would help you mitigate the risk of a future stroke. If you have blood pressure, your blood pressure has to be controlled, because this is the major complication of your hypertension. Reduce salt in the diet. For some odd reason, African American ethnicity is very salt sensitive. So even if they eat a little bit of salt, that can lead to high blood pressure. And once you become hypertensive or have high blood pressure, you just become salt sensitive. So even a little bit of salt can cause elevations in your blood pressure. So you have to be careful. Also, limit your caffeine as much as possible. It doesn't mean that you can't enjoy a cup of coffee, but limit your caffeine intake to 1 to 2 cups of coffee a day. And of course, reduce stress. So de-stress your body sometimes. Find time for yourself, make time for yourself at the end of the day, maybe, exercise, just, practice what is called mindfulness. Focus on the positive aspects of your life, positive aspects of your body. Even simple things like focus on how you're breathing, that will make you feel better. Manage your weight. This is again important thing. If you're overweight or obese, you have to try to lose weight, because just by being obese, you are increasing your risk of high blood pressure, diabetes, your heart disease, several cancers. So you have to learn to lose weight. But I am not endorsing any major surgeries or diet plans. All I'm trying to say is, if you're overweight, try to decrease your weight by changing your lifestyle, eating healthy, doing regular exercise, staying hydrated, so that you don't go on to soda next time you feel thirsty. You have to have water available so that you can keep on drinking water whole day. Next slide, please. So now we are going to talk about the factors that affect diabetes. And again, you see very similar things. Inactive lifestyle. Of course, if you are obese or overweight, you are at increased risk of diabetes. And if you're obese, your diabetes is hard to manage, because all the fat cells in the body are insulin resistant. So even though you're producing insulin in the body to fight off these sugars, your insulin is being wasted because your fat cells do not accept this. So, you have to try to lose weight, whatever it takes. Eating healthy, decreasing the calories in the diet, and staying active. You have to burn some of these calories by doing some moderate intensity exercise. So you can participate in sports, you can walk around the block briskly, or you can just do whatever works for you. If you don't have time for everything, you have to do it. Then diet is very, very important. So in diabetes, the cornerstones of treatment initially are diet and exercise, and then comes the medication. So you have to limit alcohol. You can put a lot of empty calories in your body if you are a drinker, especially if you are a pre-diabetic or a diabetic. Then you also have to learn to limit your carbs. Simple carbs are bad. So what are simple carbs? Simple carbs are things like white bread, white pasta, anything that has been stripped of its nutrition to make it look better or enhance the appearance, but it has taken away a lot of nutritive value. So limit your simple carbs. Complex carbs are good, like whole grains. They are carbs, but they have a lot of fiber in them. So those are much better. And of course, limit your sugars if you're a diabetic. You can't be drinking sweet teas or sodas, and also limit your alcoholic beverages because they can be sometimes very sugary. Some things that you cannot control are your age, ethnicity, and of course, family history. But as I told you at the beginning of this presentation, when we talk to people about these, we talk about things that they can control. So we want to empower our patients and our populations so that they take ownership of their health, so that they can learn and invest in their health. They can know what's right from wrong so that their outcomes are much better. Next slide, please. So what do we do this information? And this is pretty much bringing me to the end of this presentation. I've told you very basic things, but the message of the day is we have to do something, right? Next slide, please. Most important thing, stop smoking. You can see your primary care doctors. Just find a doctor who's primary care, go do your routine checkups. If they can find something, they can work on this. And there's a very, much, likelihood that you will be probably diagnosed at an early stage, like let's say pre-diabetes or pre-hypertension, so that we can take good care of you and you never end up becoming a diabetic or hypertensive or ending up getting a stroke or a heart attack. And most important thing really to me is knowing your numbers. This is what I call investing in your health, investing in your health. And you should know what your blood pressure is like. You should know what your ideal body weight should be. What should you eat? And what is your current cholesterol? What is your sugar level? So these things are very, very important. And, this is pretty much the take home message, that you have to visit your primary care doctors regularly so that these are more preventative exams. And of course, you have to know your numbers. I think this is pretty much the end of our presentation. Next slide, please. It will give you some important numbers, and you can look at these numbers. These are your, this is what your blood pressure should be like. High blood pressure, anything above 140/90 is considered stage 1 or more hypertension. And if you go below 90/60, it really becomes, low blood pressure, even though some people, very thin people, can have 90/60, which is normal for them. Again, when it comes to cholesterol numbers, your total cholesterol should be less than 200. Your borderline high cholesterol is slightly above 200, but up to 239. And anything beyond 240 on your total cholesterol is considered high. Your LDL, which is your bad cholesterol, should ideally be less than 100, which is where you want it to be. Sugars, again, your blood sugar, normal blood sugar is basically, these numbers are not right. Actually, your normal blood sugar should be less than 100. Your pre-diabetes is 110 to 125. And diabetes is anything more than 126 on the fasting number. So these are random numbers. If your sugar level is more than 200, this 2 hours after eating, this is basically diabetes. You don't need any other testing. But when you're doing the fasting numbers are a little bit different. Less than 100 on the fasting sugar, and then between 110 to 125 is your pre-diabetes, and that's where we start telling people that you need to change your lifestyles. Next slide, please. This is just a slide to tell you that Kelsey-Seybold Clinic is available for you. We now have this app that a lot of patients download on their phone. It gives you a lot of health tips. Kelsey does a lot of patient care webinars. I think we do have a webinar Wednesday where anybody could just log in and listen to certain health presentations. You can visit our website. You can call us if you have any health concerns. And I think this is my last slide. You can go on to next slide. Is basically, I am ready for your questions at this time.
Okay, thank you so much for that wonderful presentation. Just seeing some of those numbers, hearing some of those statistics that you gave are alarming. And like you said, it's just the tip of the iceberg. It's only what is recorded. We're going to go ahead and open up the floor for any questions. We are a small group today, so if you're more comfortable placing your questions in the chat, you can do that, or you can feel free to unmute yourself if you would like to. I have my chat box open so I can see any questions that come in, but I do have a few questions and I'll get us started.
Sure.
So in the beginning of your presentation, you talked about healthcare coverage, and we do know that coverage can prevent some people from seeking medical assistance or going in for regular maintenance, but it can be kind of tricky to navigate. Do you or Kelsey-Seybold know of or offer any resources to help people who may be struggling with getting coverage or navigating how to get coverage?
Oh, that's an excellent question. Unfortunately, I'm not an expert on that. From what my understanding is, Kelsey does not work with people in getting insurances, because typically people that come to us already are either insured by large employers or have some kind of insurance from the marketplace. And, Kelsey is like a clinic, right? A multi-specialty clinic. So we do not have our own kind of health plans to enroll people in and help them. But as individual physicians, when we see certain patients, let's say they do not have insurance, or, are having difficulty, we see anybody. So in those cases, we give them a lot of resources. So this is basically individual doctors that will say, okay, I think you need more help with this, or you have certain conditions. The healthcare can be very, very expensive if you don't have coverage. So we do give them resources to for the system that they can, or we just send them to right people who could help them more. And you are very right. I mean, a lot of healthcare disparity, really trickles down to socioeconomics and cultural differences in this country, and limited access to healthcare really increases the healthcare disparity.
Absolutely. I'm glad that you mentioned, that individual doctors can provide those resources for people.
Yes.
Because I think people may be a little bit hesitant or worried to go in, but the physicians are there to help you, and at the end of the day, they want you to get that medical attention. So the next question that I have for you is, what are some questions that we should be asking when we go in for our annual exams?
Okay, that's an excellent question. And I think everybody should do some homework when you go to your doctor's visit, or if you're just seeking a preventative exam. So, your preventative stuff is done based on your risk factors. There are certain things that we check for everybody, like blood pressure, your sugar, your cholesterol, but that certain specifics are based on your age, your gender. Some of these things are ethnicity based, and a big thing to me is your family history. So a doctor should do a detailed medical history for you, ask you about any previous diseases, your past medical or surgical history, your habits, like do you smoke, do you drink alcohol, how much, any history of illegal drug use, your sexual history, how many partners, because we are trying to gather this information to formulate or customize a plan for you. Because all of these habits or your histories can lead us to customize a plan for you. Then, of course, your family history. A lot of the things that we are going to check are going to be based on your family history. Let's say somebody in the family, a first degree relative, had a colon cancer at age 50. For most populations, the recommendation is colon cancer screening should start at age 50, unless there's a first degree relative. And then the recommendation is 10 years before that index case. So let's say daddy had colon cancer at 52. Now you should be screened between 40 and 42 and not wait until 50. And then we kind of, get more in details about heart disease history in the family, cancer history. Of course, same thing applies to a lot of other cancers, like first degree relatives in the family have breast cancer, then you are going to be screened much sooner than the regular population. And then, as I said, certain ethnicities have certain prevalence of certain things, like, Black Americans have more prostate cancer. So those men are screened for prostate cancer much earlier than their white counterparts. So those are the things that you should be asking that doctor, do I need any other screening? And you have to be very open with your physicians. You have to tell them everything. They really should not be any hesitancies or inhibitions when you see your physicians, because doctors are non-judgmental. They have to be. They are there to help you. They are there to extract some information from you so that they can formulate a plan, like a roadmap to your health for you.
Thank you so much for stating that, because yeah, the importance of being honest with your physicians. They're not asking you these questions just out of curiosity. They really want to create the best plan for you. And so I think it helps for people to understand from your perspective, like, this is why we're asking about this, because we need to know if we need to run any early test or anything like that. So thank you for that. The last question that I have for you, when you talked about the leading causes of death, you noted that many of them are actually preventable. And so certain cultural and ethnic groups may be hesitant, like you talked about, to seek regular medical care or go in for health maintenance checks, potentially due to some fear around historical events involving the medical community. So how can health experts, advocates, or just community members encourage these individuals who maybe are a little bit hesitant to seek regular care?
And I think, to me, the most important thing is communication and trust in the system. I have myself seen certain ethnic groups right now having mistrust in the system because of what has been done in the past. So I'll give you an example. A lot of people of color are hesitant to get COVID vaccine right now. This is what is a big problem. And these are the people who have most risk of dying from COVID if they get COVID. So I think it's giving them more information, and of course, educating physicians about certain biases that exist, right? Physicians should be very culturally sensitive. Sometimes you have to be pushy, but you have to be very sensitive, because certain cultures or certain ethnicities don't believe in certain things. So you have to have a very open way of communication. And how do you establish that trust with your patients so that they feel comfortable talking to you? I'll give you another example of young Black girls. Like, if they come to us and they have history of recurrent abortions or miscarriages, it's our duty to ask them, would you like me to help you with certain kind of contraception so that you don't go through that? And then educating these girls on why is it important to protect your body against, not having an unwanted pregnancy and not going through that pain of miscarriage or abortions, for that matter. And then educating them what is right for you, and giving them a very kind of open forum about, you can ask me, you can trust me, and I'm here to educate you and give you all these resources. Like, let's say, giving them multiple choices. There's no one size fit all when it comes to healthcare. Everybody is different. So every individual should be treated and respected like a unique person. There's really, and we know that the medications don't work the same in different people. What is my, kind of a sweet could be your poison. That's how the medicines work in certain people. So I think we really need to establish that trust with certain communities, give them a chance to be open, and they have to have that understanding and trust in the system that nobody would judge them. They are there to help you, and I think a lot of work needs to be done when it comes to that.
Thank you so much. So we don't have any questions in the chat. I am going to leave it open just in case, but I have been I've really enjoyed asking the question to wrap things up. For your final piece of advice, or the one thing that you would want our participants to take away today.
I am a big proponent of prevention. I talk to everybody, all of us can do better, or, improve outcomes, health outcomes in this country. And it's not just one person or two person. It just takes a society. You have to cut down on processed foods. You have to change your outlook on life. We can all get there if we want. We can improve the health outcomes, but we all have to participate in this. So I think if you get some time to volunteer in your local shelters, in your schools, go talk to kids about eating healthy. And eating healthy does not necessarily mean you have to go to Whole Foods and buy expensive foods and always spend a lot of money, because for certain groups, they get scared talking to doctors about healthy eating because they think doctors are going to talk to them about organic fruits. That's all you eat. This is not healthy eating. Healthy eating is educating them so that they can do home cooked meals. They can teach their kids, and this is going to be generational. And if you see across the world, there are certain groups or populations that are not um, economically kind of up there, but their health outcomes are better because culturally they know certain things, they know how to do right, they know how to eat green vegetables, and they can have their kitchen gardens, they grow that. So there are certain things you have to really teach your uh, ethnic groups and populations that this is what you can do. And this is where a lot of mistrust comes from, because people really think the doctor is not going to understand my economic situation. It's easy for me to go take my family to McDonald's and have a $1, whatever sandwich or burger, whereas you want me to go get like a more expensive wrap or something. It's not that. You have to learn that healthy eating is important. It prevents disease and risk of dying from that disease in future, and it doesn't necessarily have to be expensive.
Thank you so much for sharing those wise words. We actually talk about nutrition and ways to eat nutritiously on a budget as
Right.
well. So we feel you on that one. Thank you so much for joining us today. We really appreciate you taking the time to give this presentation. For those of you who may walk away today and later on you have questions, you can always email us at healtheducator@thewomensfund.org. I also have a survey link that I will be sending out in a follow-up email. We'd love to hear your feedback, know what you liked, what we could improve on, and additional topics that you would be interested in. I also encourage you to visit our website to learn more about our organization and our social media pages as well. We do have some upcoming presentations to close out the week. Immediately after this, we have a presentation on the impact on health of lead exposure and toxicity. And we have a presentation tomorrow, BIPOC Coping with Trauma. So we hope that you will join us for those presentations, and we appreciate you joining us today. Have a great rest of your day.
Thanks. Bye. Thank you.